Hi, I am Vlad, an ICE 50 avatar, and will present this interesting article. Diagnostic failure. The patient/plaintiff, a man in his 50s, had been experiencing swelling and pain in his lower jaw. He had been to a primary care physician, who prescribed a broad-based antibiotic. After a 7-day course, the patient's symptoms had not changed, so the primary care physician prescribed another round of antibiotics at a higher dosage. After that round of antibiotics did not give the patient any relief, the patient sought help from the defendant dentist. The dentist determined the problem was with tooth number 31 and he extracted it. After the extraction, the patient reported the pain and swelling did not change. The patient then saw a periodontist who noted the lump the patient had earlier described as being soft was now hard and fixed. The periodontist called the dentist, who advised that the patient was simply healing from the tooth extraction. As time went on, the patient's symptoms worsened, and he sought care from an oral surgeon who quickly diagnosed actinomycosis, a rare infection. The patient was hospitalized and underwent 3 additional surgeries within the next few years, which left him with a permanent cosmetic deformity. The patient alleged that if the defendant dentist had simply taken a culture when the patient sought his help, he would have discovered the infection earlier, treated it, and the prolonged problems and extra surgeries could have been avoided. The dentist denied any wrongdoing and maintained that he could not have diagnosed such a rare infection, and he did not have enough tissue or drainage to test. The dentist also stated that he did not test or take cultures as a matter of practice. A verdict of over $1 million was returned by the jury at the conclusion of the malpractice trial, including over $750,000 for pain and suffering and over $200,000 for loss of consortium. Controlling the risks associated with infections. Infections are potential unwelcome sequelae for almost any dental procedure. Infections often precede or exist concurrently with dental treatment, possibly compromising the treatment's outcome or complicating the health status of the patient. Therefore, it is understandable that malpractice claims against dentists often cite infection as the claimant's injury. Responding to an infection. Thoroughly evaluate the patient and assess all possible sources of the infection. Clearly inform the patient of his or her condition. Explain the urgency of treatment. Explain the potential consequences of no treatment or delayed treatment. Recognize and refer immediately when the patient's condition is beyond your treatment expertise. When appropriate, prescribe an antibiotic regimen suitable in dosage, duration, and choice of medication. Legal notice. This article is for informational purposes only and does not constitute professional advice. The views expressed in this article do not necessarily reflect those of ICE 50. One must consult with their legal representative for any and all legal advice.